The Caregiver Respite program at the Mississauga Halton LHIN provides 5 services through a central intake system and was designed for and around caregivers who need to have support within a network of care. The 5 services provided in the program are in-home respite, caregiver counseling and education, emergency respite, out-of-home respite inclusive of short stay and long stay, and adult day services. Respite advisors counsel and educate on the services available to the caregiver and coordinate entry into one or more services. The in-home respite services, or recharge, provides 268 to 365 hours per year. A reserve is also available for those in crisis. The service enables the use of in-home respite hours to be flexibly used by the caregiver in their own time and way. Examples are day, overnight, weekend, vacation, appointments, or things such as surgery. Anywhere from 2 hours to 24 hours per day. In total, 3 agencies provide all the service.
There's also evidence that there is decreased use of long-term care beds, decreased use of emergency department visits, and also acute care services.
The Regional Learning Centre provides education and support to informal caregivers who live in the Mississauga Halton LHIN. As part of the Caregiver Respite program, we provide monthly training sessions for caregivers on a variety of topics, including continence, safe moving and handling, and hearing loss and communication. The Regional Learning Centre has 2 large training areas, one of which is a fully equipped skills lab so that informal caregivers can come and get hands-on with various moving and handling equipment. We know that caregivers can feel isolated sometimes and perhaps not know where to turn to obtain credible information about how to care for their loved one at home. The Regional Learning Centre is filling that gap. All of our courses are free, they're evidence-based, and they address the issues that tend to arise in the home care setting.
There are situations that come up with a caregiver, extenuating circumstances, where they can't be providing care to their loved one, and the person does need to be safe and secure and be supported in the way that they need. And so emergency respite allows that person to go somewhere and be safe and receive all the care that they need, where the caregiver recuperates. One of the programs that we use is in conjunction with the hospital through our First Link program at the Alzheimer's Society and through the Peel Regional Police Services, where if someone wanders and is picked up by the Peel Regional Police without any identification on, we engage through an emergency service protocol within the Alzheimer's Society, and that person is brought to a respite care home, to Nora's house specifically, until loved ones are found and appropriate care is provided during that time. Being available 24 hours a day is too much for one person in one family unit, and so our job is not only to provide the care when we need to or when our buildings are available and when our staff is, but to think of situations where that caregiver would need our help.
So at Oakville Seniors, we have 2 short stay beds that provide our caregivers with respite for 2 nights to 14 nights, which they can make use of 3 times per year, and also on an emergency basis. Our staff is available 24 hours a day to the 2 rooms, which provides peace of mind for the caregivers.
ADS, there's 10 providers with 17 locations around the Mississauga Halton LHIN, and they're physical buildings that are staffed and secured and have a number of programs that are provided for people. For example, where I work, they're provided for people with dementia.
By 2032 to 2033 in our LHIN, future demand will exceed supply by 700,000 hours. Our capacity study articulated strategies are needed to support paid care and increase the supply of informal care. Here is the respite program by the numbers. The Mississauga Halton LHIN has invested $13,800,000 to date. In-home respite has provided 600 caregivers with over 124,000 service hours. Adult day services have provided 1,483 individuals with over 81,000 days of service. The respite advisors have provided 1,849 service interactions. Emergency respite has provided care to 420 individuals for a total of 5,020 24-hour days. The program shows that 52% of caregivers are 45 to 64 years of age, while 41% of caregivers are 65 to 85 years plus of age. Over 60% of caregivers' loved ones have dementia on the program. A higher proportion of caregivers have experienced improvement rather than decline after 6 months on the program. And in 1 year, one service alone on this respite program has provided savings of over $860,000 as a result of a delay in long-term care admission.
My experience with my husband having dementia for 11 years. In the end, because there was no place for me to go, my husband ended up in the hospital and I really had to do it on my own. Now there's a one-stop place where you can go to at least learn about the options. The respite program for me is very important. This is why I'm on the committee, to see that people have access to different options that I didn't have.
I just like to say thanks to the government for giving caregivers time off from their jobs. I always thought I was a superwoman and I could do everything. Anytime, no problem. Well, you get burnt out very fast. I wish that the government could do more or keep this program going and allow more hours so more people could get into this program, because it is, I don't know, it's my sanity. I can't say enough. Everybody needs to have it.
Please don't take my sunshine.